The following is a demonstration of a veterinary surgical procedure produced for vetsurgeon.org, vetnurse.co.uk and their associated YouTube channel, Brains and Drains. It's been made for the benefit of general practitioners, veterinary students and veterinary nurses in the UK and around the world. And as such, it offers a great sponsorship opportunity for any company which wants to support the profession with free, high-quality demonstrations of veterinary technique performed by experts. If you'd like to sponsor this film, this section will be replaced with an introduction in which I'll thank you for your support and explain why viewers should use your product or service. Thereafter, your logo can be positioned top left throughout the film. The film will then be shared on YouTube, where we have over 2,000 subscribers, and with our members on vetsurgeon.org and vetnurse.co.uk, and promoted on Facebook, LinkedIn, Instagram and Twitter. If you'd like to extend the reach of the video still further, you can also, at additional cost, send an email announcing the film and your support of it to the members of the sites.
This is Lila. She's a approximately 4-year-old cat, a rather uncertain history, been in the owner's possession for a few months. And during this time she's always had a tendency to dyspnea, inspiratory dyspnea and snoring. And the referring vets have examined her under anaesthesia and suspicion of a nasopharyngeal polyp. We've done a CT which confirms the presence of a nasopharyngeal polyp and also of unilateral otitis media. We'll show you the CT films separately. So we're going to use traction to remove the polyp, as you'll see. So in a moment we're going to reposition her so she's on the back. And then the instruments I use are Alice tissue forceps to hold the soft palate, and then some small right angle forceps which are useful then to open the space and grasp the polyp to remove it. Sometimes it comes out very easily, on other occasions it can take several attempts to grasp it successfully before it's removed. Here we have Lila's CT scans. We've got slices dorsoventral through the skull. So we're starting here in the middle of the nose, and then as we come further back you can see each nasal cavity here. Further back again, this is all unremarkable so far. Now we're beginning to see the nasopharynx here above the hard palate, and as we come further back, here's the nasopharynx above the soft palate. And here, coming into view as I scroll backwards and forwards, you can see that the majority of the nasopharynx here is filled with a soft tissue density, seemingly based on the left side, rather circular, rather globoid, and very typical of a nasopharyngeal polyp. And as we come further back again, we'll come to see the middle ears on each side. So there's the right middle ear, which is pretty normal, air-filled in both the inner and outer chambers, and on the left side we can see soft tissue density. This is non-contrast, it could be fluid or it could be polypoid material occupying both chambers of the middle ear in this cat. I think there's minimal bone change around this. There's certainly not signs of gross bone thickening or proliferation. So this may be a candidate where the problem may be resolved by traction of the nasopharyngeal polyp followed by corticosteroid therapy rather than requiring a ventral bular osteotomy. So that's the plan in this cat. Once it's recovered from anaesthesia, it will be discharged with the course of post-operative corticosteroids, and we'll see what progress it makes over the coming months. So Lila has a nasopharyngeal polyp, and we're going to try and remove this with a traction technique. As you see, she's in dorsal recumbency under anaesthesia. We've got an endotracheal tube in place, and my nurse is holding the tube because that will be easier to move around than if we have it tied in place. We'll start by opening the mouth. Could you hold there, Abby? Hold the mouth open for me. Hold the tongue. That's great. If you hold the tongue, then I'll be good. I'm going to bring that on that side. I'm going to put a little bit of local anaesthetic in here. She's already had some of that on. So the polyp will be above the palate here. You maybe appreciate as I push this way there's something firm on that side, so that will be where the polyp is. Now I'm going to grasp the caudal border of the soft palate and pull it forwards, and then I can appreciate that there is a mass in the space there. There you can see the polyp just popped into view now. See this pink firm tissue that I'm touching with my forceps here. And to get a good grasp around that. Not got a good hold yet. Give it. Swap the area and try again. Some of the polyp, but hopefully we can get more than that. And finally, we have the polyp.
Oh, hang on, let me just
Yep.
pull back from around it because it's.
Yep.
Very good.
Well, that's most of it there. We had a little bit before. No bleeding obvious at the moment. that for a moment. Give it another swab, and then we'll let everything rest, and then we'll have another look at some mucus here, which will be accumulating around the polyp. A bit more polyp come out on the swab there. And it looks pretty clean there now. Some swelling after rather more manipulation than is usually necessary, but no longer any polypoid looking tissue coming out. So we're there. We're going to give her some corticosteroids to reduce the inflammation, and then we'll gradually, slowly wake her up. So we've removed the polyp there, and as you see, I use some standard Alice tissue forceps typically to grasp the caudal board of the soft palate, and then either another pair of Alice tissue forceps or some right angle forceps are helpful to remove the polyp itself. This is the polyp here, a globoid piece of soft tissue, and you can notice reassuringly that this actually has the stalk here. So this is the polyp, the stalk of the polyp that would have been coming through the eustachian tube from the middle ear of the cat. And we'll now be recovering from the cat from anaesthesia. We're going to give it some hydrocortisone to reduce swelling after the surgical manipulation.